I've got 8 minutes to speak. I'll just made few slides for you, but I'll basically be discussing things about what basic occupational health services are, one, and what is an unorganized private sector, what is the organized sector of workers, and what services are available to them, and what government is doing or going to do for these people. Unfortunately, the unorganized sector is really lacking the healthcare, but it has been covered more so in the Ayushman Bharat Jan Arogya Yojana. A good amount of people have got the services, and now we have increased those services from 10.74 crore families to 12 crore families. And we have also asked the states to include any and the eligible people who are really not getting the services but are eligible for them. So they have the right to add the people now, because there are 1.45 crore more families which are allowed to go through in the scheme. And also, if there is a lack between the data which is not being found by the state, they can add the other beneficiaries which they think, for example, the unorganized sector workers, into that ambit. So just going through the slides, I just wanted to tell you about that, what they include. Anybody who is working at a home, who are self-employed, wage workers, construction workers, these are the people who are the part of the unorganized sector, and 90%, I tell you, 90% of them are unorganized. Only 10% get that benefit of ESIC or the organized sector advantage, actually, which they get by paying some amount of money, maybe 0.75% of their salary, and contributed by 3.25 by the employer, and they finally get the health services to them. Occupational safety program are only for them, and they are not for the unorganized sector, unfortunately. Just the data which I have got from the study, which is available on the National Institute of Health and Family Welfare website, is that out of 100 million non-fatal injuries, 17% are from India, and 45% of fatal injuries are from India, which has occurred in the year as per the study. So, as I told, there is no recognized agency at present, but yes, we are doing our bit, and we are trying to include those which are not covered, and the government is hellbound to change it and work toward UHC and give the facility to these people who are really needing that. A few initiatives are already there. There is a DG Factory Advisory Services, DG Mines, which takes care of their people, but actually there is no such body which takes the ownership at present, except ABPMJ, which includes all of them. So I think the 4 days have already been gone, and everybody must have known about the major diseases like pneumoconiosis, asbestosis, and other diseases, the injuries happening at the workplace, basically the bone and muscle injuries. And then just the data again I wanted to show. In 2011, out of 101 workers in the stone mining area, 73 suffered from silicosis, and out of them, 16 has progressive, massive fibrosis of lung. So it's a very huge number. 75% of people have a noise-induced hearing loss, huge, and they should be taken care of. There should be a preventive measure for that. The people who are working with heavy earth-moving machinery, a majority of them get some disease because of the vibration. Maybe dozers, loaders, dumpers, etc. So what is basic occupational health services actually mean? It's giving the primary health care and the secondary services to the occupational health sector. It tries to include everybody, actually. So it is jointly developed by the WHO and been collaborated by the ILO, and ICO also plays a role in it. IOH also is a part of it. It emphasizes to take care of all workers, and basically more strongly, what we say, putting an eye on prevention of the things rather than treating the ones afterwards. It takes care, it aims at protection of the health at work, promotion of health, well-being and workability, and prevention of any occupational diseases and accidents. It includes surveillance, emergency care, first aid, as well as health education, as our previous keynote speaker has told, that is an important part of the thing. And yes, incentivization is a very important part of it. Every thing actually which is going to be introduced into the ambit of this thing should be incentive-based and outcome-based. So as the previous speaker in keynote has addressed that thing by cash incentive, it can be otherwise also, incentive in a way of any kind of services which they get and otherwise. So the Labor Ministry has a policy which takes care of safety, health and environment at workplace. It was given in 2009. It has the guidelines which gives you the guide for maintaining safety, culture and environment at the workplace. Also deals with the provision of statutory framework and rules for that. And MOHFW has launched a program in 98-99 which takes care of the prevention and treatment of the occupational diseases. So just rushing through because I have very less time, and I'll just tell you about Ayushman Bharat, and everybody should know it. It actually is one of the very good scheme which a government would have introduced. It really gives good cover to people who were really, really in trouble, and they were going under poverty after getting the treatment and must have sold their lands and then were in the ambit of not able to pay the money which they bought. I can have 2 more minutes if you allow me, because it's very less time, because I just wanted to tell this to people and they should know it. So we are, the construction workers are there, plumbers are there, which are part of it actually, but we are going forward, one step forward. I will just brief in 2 slides, which is what it is. The primary objective of this scheme was to decrease the OOP, the out-of-pocket expenditure which really takes them below poverty. And PMJ provides that cashless benefit to them with 5 lakh cover. All ages, all people from the first day are included, all diseases from the first day are included in this. All the pre-existing conditions that I mean are included, and even 3-day pre-hospitalization and 15-day post-hospital medicine and visits are covered in it. And food also is covered in it actually. So, and it is portable across India, and any state can have can treat people from the other state, and yes, public hospitals are reimbursed in the same rates. So I'll just go through 2 more slides. There are state scheme also which are catering, and they really cover nearly 80% of them, inclusive with the PMJ. And the Building and Construction Worker Welfare Board has tied up with us, and we are now delivering the service in 5 states at present. So these are Bihar, Chandigarh, Nagaland, Uttar Pradesh and Madhya Pradesh. They are already having 35 lakhs workers which were not a part of SECC, but now are getting the coverage under a BOCW convergence scheme of National Health Authority, which I am heading. And we are going to include all those 6.2 crores in the coming time. We have nearly spent now 64 crores in last 1.5 years on treatment of the building and construction workers only. We are going to include manual scavengers also. They are part of the ABPMJ as such, but yes, we will be having others. We will be scrubbing the data now. We had a meeting with the MOSJE, and they are giving us the data, and we'll be scrubbing it through the Ayushman Bharat data. And finally, we'll be putting all those people who are not the part of manual scavengers in ambit in SECC will be getting the benefit. Thank you.
Thank you. Thank you, Dr. Pankaj. Thank you so much. May we have questions for the speaker?
Dr. Pankaj, thank you. Just not a question and one advice. The various organizations, they put their policies outside their organization, inside the organization, outside the occupational health center. Do you believe we should put national policy on occupational health?
See, my belief is that every policy has to be on one platform. So if it has to be introduced, it's good. It's good for all, but it has to be deduplicated with people which are already getting it. We have a small pie. The resources are small, and we need to use it very properly and in a very judicious way. So just for example, I'll tell you, the manual scavengers are a part of ABPMJ, a lot of them. 57,000 means nearly 30,000 are part of it already. So we can only scrub the data when we have a data on one IT platform. So NHA has the IT platform, which we are ready to give to anybody who is willing to provide health services. And what it helps in, It's nearly 90% of data is Aadhaar based with us. So we immediately, if I am Pankaj Arora, I add my name to it, and I want to take a facility. When I go to the hospital, it will ask my thumb impression or my iris or my face authorization, because it is not allowed to take treatment without any of the authentication in ABPMJ. So if I am a ABPMJ beneficiary, it will not allow me to take any occupational health benefit if it is my platform. It will say you are a SECC beneficiary, you will be booked under PMJ. If not there, then the second line, if he's a CAPF beneficiary, if he goes and checks, and it is like for example, his father was also enrolled in PMJ, he will not be allowed to take the CAPF unless he writes it and takes to get off that scheme. So what it helps in that we can distribute our resources well. So your suggestion is well taken, and it's the right thing to go about, and anything which is helping people in health, it's an investment actually. So it leads to productivity, and it leads to the economy, and it leads to excellent growth of the country as such. So I never talk it as a spend or as a expenditure. It's an investment. And if you want to start that thing, please talk to us and ask us for the platform. We'll ready to give it to you in a way that you can populate the data. We'll take it from the APIs which you will provide us with the Aadhaar-based authentication, and we'll allow only those people who are authenticated once at RBIS to take the treatment. So it saves you money, and no fraud can also happen. So
Thank you for the insights.
Fault prevention thing. Thank you.
Thank you, Dr. Pankaj.